Welcome to Humanly Possible, a vlog and podcast series focused on the game-changing potential of creating human-centric workplaces. On this episode, we're joined by Dr. Lindsay Malloy and Dr. Amanda Zelechoski, two psychologists, moms, scholars, and researchers. Together, Lindsay and Amanda co-founded Pandemic Parenting, a nonprofit organization and community for parents and caregivers to easily access resources and valuable research to help navigate the unique challenges of the COVID-19 pandemic. We unpack Lindsay and Amanda's personal experiences and discuss their evolving research on the impact of the pandemic on other families. We also discuss the role of employers and leaders to incorporate flexible and equitable workplace design for working parents and caregivers. Welcome to Humanly Possible. I want to introduce our guests today. I'm excited that we have two brilliant guests to have a great lively discussion. We have Dr. Amanda Zelechoski and Dr. Lindsay Malloy, and both are co-founders of a nonprofit called Pandemic Parenting. And so I'm really excited to have this discussion because there's such a need right now to have conversations around supporting parents in the workplace. So Amanda, I'll let you start with your introduction first.
Sure. Thank you for having us, Angela. We're really excited to be here to talk with you today. So I am an associate professor of psychology at Valparaiso University, which is in Northwest Indiana, and am trained as a clinical and forensic psychologist and attorney. And my research tends to focus primarily on child trauma and just how trauma then intersects with the criminal justice system and in various forensic settings. And so I spend a lot of time thinking about early adverse experiences and how those go on to impact our lives in different ways.
And I'm Lindsay Malloy, and I'm an associate professor of psychology at Ontario Tech University, which is in the suburbs of Toronto. And my research focuses on children's involvement in the legal system, broadly speaking. So looking at children's memory, their life narratives, how they talk about the past, essentially. And a lot of that has to do with how they talk about past negative experiences, traumatic ones, maltreatment, or potentially illegal behavior in the case of juvenile delinquency, and thinking about how interviewers can best get accurate, detailed reports from kids when we suspect that something has happened to them. So that's where my research is focused. And, I obviously engage in all sorts of other teaching and service-related stuff. And then in August of 2020, co-launched this nonprofit with Amanda, which was not something we really had in our plans at all. And but we've been really excited about how it's going and the chance to connect with a lot of parents and get some good research into their hands.
So Lindsay, can you tell us a little bit more about Pandemic Parenting, why you decided to start it along with Amanda, and what you've been learning along the way since the launch?
Yeah, absolutely. So one thing that's a bit odd is that Amanda and I have never met in person. So this is the sort of classic pandemic relationship that has developed. And so we knew of each other's work through the American Psychology Law Society, where we're both members, and we had sort of interacted on Twitter, so that social media presence. And then Amanda contacted me in July saying, I kind of, have this idea, I want to run by you about how we can essentially how we can get good information into the hands of parents, because we were both conducting studies on the impact of COVID-19 and the pandemic on children and families. So we were both sort of independently doing those studies with our research labs. And, Amanda was talking about, rightly so, that a lot of times this research science, it takes a really long time. And, to get it published, to get it out there, and then even if it does get published, which can take, a year or 6 years for some of us or whatever, what have you, then it's not really accessible to a lot of people, literally because there's paywalls and such, or figuratively because it's just written for a different audience. And so we wanted to try to distill some of that information from our own studies and think like they need this right now. Parents and families need this right now. So let's try to get that into their hands, but also just general psychological concepts and theories and findings and what is known about, parenting and children's reactions to disasters. Like we know a lot of stuff that parents could use right now. So it was trying to get that to them in a way that was free and not like a lot of stats, just jargon free delivery of that. Is that, have I done
Yeah,
an okay job?
and in a way that is right, accessible, but I think for us too, it was also in a way that is relatable. So Lindsay and I both didn't mention, but we're both also pandemic parents ourselves right now, right? So I have three young boys, 11, 8, and 5. Lindsay has two kids, 5 and 3. And so we were in the thick of it ourselves, struggling right along with all of these other pandemic parents all over the world. But recognizing, as you said, Lindsay, that we sometimes have access to information or aspects of our training around some of these psychological concepts that could be helpful to people that we take for granted sometimes and forget how hard it is actually for a lot of people to access psychology. And that's a problem. That's a big problem. And so, we just sort of realized, what is the support that we could use right now, and thinking that through. And maybe there's a way we can take what we've learned from the research and translate and disseminate that in really engaging and helpful ways, but in real time, like quickly, because people need answers now and they don't have time to read the 300-page books on each of these topics. So how can we get this stuff to them right away in a way that would be helpful to us as struggling working parents too?
And we're lucky that our networks of other colleagues around the world, right? So, we have our own narrow expertise, but then we also are like, okay, well, my old friend and colleague is an expert in children's, in screen time. So let's call him up and call in a favor and see if he'll come on and talk about screen time with us. And so just having those networks allows us to kind of pull in people who have the expertise that a lot of parents need. And we're right there, like taking notes too, right? Like we had one on managing sibling conflict recently. And, that was something that was of great interest to Amanda and I.
Yes.
During a pandemic, and while, families are cooped up with each other, that's like another layer of expertise, right?
Exactly.
Yes. Exactly. Yep.
Yeah, and I love what you said around making it accessible and kind of this idea of I think with research and academia, we are oftentimes behind the scenes doing quantitative and qualitative research and then waiting for perfect to happen before releasing results or sharing results. And so it sounds like you've talked with researchers, but from what I've read and done my own research on, you've also talked to actual parents and worked in the community. And so who are you talking to other than experts, and what does that process look like?
Yeah, I think we've been trying to do a lot of outreach, get feedback from folks, what is helpful to you? What are the ways you want this information? We're constantly evolving as an organization and figuring out, most people don't have time to sit through a 1-hour webinar. We've tried to really cater to parents. And so we intentionally do them later, at 9 p.m. on, most of the time, because we don't want it to be in the middle of your workday if you work traditional hours, or in the middle of dinner and bedtime chaos, which we know all too well what that's like. And so, we've tried to make things really accessible for people's lifestyles right now in the way we're living through the pandemic. But we also realized, okay, there are other ways to do this. So we'll take these, 1-hour webinars and convert them into these 1 to 2 minute snack break videos, because we don't have time. We want a quick answer and we want to get an answer to something from an expert, in a 1-minute video. That's easier for me to digest than reading a really long article or newsletter. We partnered with Zulily to create these blogs in really accessible ways and, translate a lot of the psychological concepts into really sort of fun, ways of talking about it. And Lindsay and I have had a blast with that, because it's not the traditional academic writing we're used to doing. It's so accessible. It's here's examples from my family, and here's what worked, and here's what absolutely didn't work, and here's why. And here's the psychological concepts that might explain why that didn't work. So we've been able to use some of those concepts from the psychological science, but in ways that we think are easier for people to, hear and learn. So lots of outreach, talking with parent groups, teachers, school groups, just lots of community organizations trying to keep figuring out what is the best way we can be helpful to give this information away.
Talking with media as well, which is something that I find very challenging, but we've done like stuff on TV, like live TV segments, and then you really have like 30 seconds to boil it down to, what is the biggest take-home message for parents about this topic or in this kind of situation. Like around the holidays, that was a big one, right? Like, how do we make the holidays special for our kids, and how to best cope with this? And so, yeah, we've been talking to parents, journalists, podcast hosts, like wherever we can get, more people informed and the information out there that we kind of exist and that we have these resources that are free and, they're credible experts who are coming on. So, I mean, there's no shortage of information out there about parenting. Like any parent knows that you only have to go on social media, and you'll get advice from strangers or this blog or this blog. And it's like, but how do I find out I don't want to say the correct, but a lot of people want to find out the information that is informed by research or by science, by people who've spent their whole lives dedicated to these different issues. And so that's what we're really trying to get to people.
So let's talk about that research, because I am really curious to understand and know the impact, and I'm sure the listeners are, on what the impact of the pandemic has had on parenting. And so thinking about not just parenting as a whole, but also mental health of the children and the parents. So maybe starting with you, Amanda, if you could kind of distill down some of the findings that you and Lindsay are seeing, and the trends we're seeing during this time, and what's changing as we're getting to this different phase in the pandemic.
Yeah. So the study that I did very early on in the pandemic was really looking at what is the short-term impact, from the interesting thing about COVID-19 and the way that it sort of began is that for those of us who study a lot of these crises and traumatic incidents, we don't know that they're coming, right? So we're always studying after the fact, 9/11, Hurricane Katrina, we're able to study what the impact is afterwards. Excuse me. But with the pandemic, I mean, we kind of had a heads up that this was coming, depending on how seriously you took, various commentators about that or researchers. And so knowing that, we were in this unique position to be able to actually collect baseline data. How are people doing before it happened? And then look at what the aftermath looked like. And that's pretty rare for those of us who study, crises and trauma. And so, that was something that was really interesting to me was this is going to get really bad. Lindsay and I study child maltreatment, and this is a recipe for disaster related to child maltreatment, because you're going to have kids that aren't in school. You're going to have extremely stressed parents, and people are going to be isolated, and we're not going to have teachers and a lot of the other grown-ups in kids' lives having their kind of eyes and ears out there to protect kids. So child maltreatment rates are going to go up. But the challenge is we're not going to have reporting the way that we usually do. And so I was really worried about that. And that was why I wanted to study. And I was really worried about how the heck am I going to manage this as a working mom? Like, this is going to get really bad in my house too. And so, studied that, and we followed about 450 families over the first few months of the pandemic. And what we learned is that, parents were really struggling, kids were really struggling. The challenges for parents of younger kids, so school age, like infant, toddler, all the way up through, say, middle school, were very different. The stressors were different than parents of older kids. So parents with younger kids seem to be struggling more, in part because of, of course, the supervision and management that you need with younger kids than you do with older kids. So the stress looked different when your kids were younger, like the ages of Lindsay's and my kids, than if you had high schoolers or you had college students who abruptly had to come home. A couple other things we learned were that younger kids seem to have more what we call externalizing problems. So things like aggression, disruptive behavior, tantrums, that was how they were struggling from a mental health perspective and acting out. Older kids, like middle school and high schoolers, had more internalizing problems that emerged in those 3 months. So withdrawal, isolation, symptoms of depression, those kinds of things. And so the mental health issues looked different depending on the ages of the kids. we had about 1 in 4 kids that the parents rated as showing an increase in these emotional and behavioral issues over just the first 3 months of the pandemic. So that's really striking and tells us, hey, if that's what we saw in the first couple of months, what is this going to look like a year later for many of our families and our parents? And then the other sort of big finding for us was that, parents who had kids with special needs, of course, were struggling a lot more, and their stress really was exacerbated in many different ways because of how much they were having to manage at home without the resources and supports they were used to having. So those were some of the big takeaways for us. And again, like I said, we only looked at the first few months. And so some of the trends we're seeing in other people's research in a number of the articles that have been written are that around the 6-month mark, people actually started faring worse from a mental health standpoint, that they were okay and sort of, resilient, and maybe we'll talk about resilience, but, we're able to sort of hold it together and manage this in the beginning. But around that 6-month point, when we saw this isn't going away anytime soon, that's where we started to see things like suicide rates increase and mental health really suffer for parents and kids. Lindsay, what about you? Your study talked about some really cool things, like how to talk to your kids about this stuff.
Yes. So I don't have as many findings as Amanda at this point. But I can say that we collected data from just under 2,000 families in the US and Canada. And, wide age range of kids. And our big focus was on how parents were talking to their kids about COVID-19. So one thing I can say is that there's, huge range of like individual differences in how families are communicating about this, right? Like you have some that are very actively communicating about it. And in past research, like when you're talking about hurricanes or, the Boston Marathon bombing, that style is associated with children faring better. And then you have families who are more in the kind of avoidant communication style. Like they're not talking about it. They're asking other people not to talk to their kids about it. They're, not explaining what's happening in the news and things like that. And that's associated with poorer outcomes for kids and other kinds of disasters. So, but what's interesting is that, we've never, like Amanda said, this is a whole different ballgame because yes, we did know it was coming, but also it's stretching on for so long. Like most other tragedies or disasters that have been studied are like one-time events. And this is ongoing. We're about to hit a year since, things really shut down in North America. So so we've done like, early on, then we did a 6-month follow-up that we're still analyzing. So it'll be interesting to see. But, in addition to the things that Amanda mentioned, a lot of sleep challenges for parents and kids, especially as people are like stuck at home, their routines are all disrupted, and that disrupts our sleep. And of course, sleep ends up affecting so many other aspects of our mental health, like depression, and it can affect suicide and things like that. So that's something to think about. And also boredom. Like when this first started, we were really concerned about anxiety. And like, that's what has been studied a lot with other disasters, anxiety, PTSD. But a lot of what a lot of parents and kids seem to be experiencing is just like this listlessness, just this boredom and like loneliness. And so, yeah, there are different things at work here that I think we're not going to fully understand for quite some time, but we are trying to.
Yeah, and so I appreciate you both sharing that research because really the connection I wanted to make and the discussion that we can kind of end with here is around how leaders, executives, workplaces can support parents during this time. And I think it's kind of spilling over into generally, right? Like let's understand the parent's experience not only through a pandemic, but how that contributes to the work human that's coming to work every day, and how we can't ignore the fact that being a parent is a part of your being and a part of you and the person you bring to work. So some of the things that, just to add to some of the research around your piece here is around the workplace and human-centric workplaces. And what I've been finding is parents are saying, give us more resources, which is exactly what pandemic parenting is doing. But really what I've distilled this down to is flexibility. provide us with the grace and the flexibility to manage our work, give us choice. And I think that's especially true for parents who are going through a pandemic, but provide us with outcomes-based leadership so that we can get the work done in a way that works for us. How does that speak to you, Lindsay? And what are some other things that workplaces can be doing to support parents during the pandemic?
Yeah, so many thoughts. So first, I think parents, for sure, but just really anybody with caregiving responsibilities, right? Because a lot of people are in a position right now that even if they aren't parents, they're having to really take care of their parents right now, or they're the ones who are trying to get their parents vaccines and like spending all day on an online platform trying to do that. And a lot of people like the sandwich generation, right? Like they have young kids and they're taking care of their parents. So just something to keep in mind. And I think this pandemic has really highlighted like all the stuff that a lot of working parents have been dealing with. All these challenges have been always there to a certain extent, but the pandemic has really like it's kept us from hiding them as much, right? Like I might have a phone call or something to one of my kids' schools, but it's different when like my kid comes walking into the middle of a meeting with like the vice president of research or whatever. It's just much harder to hide than it was before. So I think it's really brought to the forefront a lot of issues for parents. So in a sense, I think it's good these things are more visible. So what can workplaces do? I think just first of all, just acknowledging the challenges. I mean, I'm sort of surprised that there's a lack of acknowledgement in a lot of situations about the challenges that parents are facing. So I remember one time my daughter came walking into a meeting and, right away, one of the really like high up admin people was like, oh, looks like we have, a little visitor, and was like really pleasant about it. And that was really nice. Now I know some people might feel like, oh, why did they highlight that? I don't want, so I know there can be individual differences there, but for me, it was really nice to have, them sort of acknowledge her presence there. And I think just thinking through what the challenges might be or talking to parents about what they are, because, frankly, a lot of whether it's a university or, a Fortune 500 company, a lot of the decision makers are older men, like who may not have young children, or they had them 25 years ago and they just forgot because of retrospective memory biases, right? Like we don't remember how things were and how challenging it was. And so they might not be thinking about that. So yeah, so getting parents involved in the decisions.
Yeah, I think, wow, so much there too. And I love, Angela, that you use the word grace around this. Like, I think that's something Lindsay and I have been talking with parents a lot about, is this notion of giving yourself grace and that flexibility piece. So when I think about employers, one of the biggest things is exactly like Lindsay was saying, you may be far removed from what these parents are going through right now. And so there have been many times we've tried in our writing and in these conversations, to paint that picture of what it looks like for us as working moms who are resourced, have partners who we can trade responsibilities off with. So for us, much of the time it means I'm managing my kids' remote learning for 3 different kids on 3 different devices potentially. And this one's crying because he got kicked out and this one can't figure out his assignment. And so the emotional upheaval and chaos in our house that I'm trying to manage all day long, in between doing emails and trying to do my work, that at the end of the day is actually when I can finally sit down to do my work. And my work hours became like 9 p.m. to 2 a.m. But I'm so emotionally exhausted by then from this day. How productive am I able to be? And so just painting that picture for employers to understand that, this is not parents trying to be lazy, trying to make excuses. Like, we are having to do all of the things all day long for everyone. And that's exhausting. And so I think sometimes that helps people to then get like, okay, so that flexibility word you used, I think was just key, that, giving your staff the flexibility. Here are your marching orders. Like, here are the tasks I need you to do. This is how I'd prioritize them. but I know that you're going to get to those when you can. And so, work with that and trust that your staff are going to be able to figure out what makes the most sense for them. I think that's been the frustration, is a lot of companies are used to, managing, you are here for these hours. Like, I just don't have that luxury when my kids also need me right now. But I will get it done if you let me figure out the way that works the best within my system, within my family. And one other thing I just wanted to highlight there was, Lindsay and I have talked a lot with parents about this, the concept of decision fatigue. Mm-hmm. So that this is, a lot of people aren't realizing, like, why am I having such a hard time just deciding what to make for dinner tonight? And it's because we've been having to make decisions all day long, especially in the beginning of the pandemic, but even now still, right? Around, is it safe for us to go to the store? Is it okay for me to send my kids here? What are the rules? Will there be social distancing? Like, these decisions that actually feel pretty heavy and don't have easy answers, because PS, this is our first pandemic. We've never done this before. And so, we're making those decisions all day long. And so similarly for your work, you're triaging, like, what do I have to do first? What's more important? I'm not sure if my boss meant this, or do I respond to these emails or work on this project? Like, that's exhausting. And we are not cognitively wired to be doing that at the levels we have had to, as Lindsay said, now for the better part of a year, and deal with all that uncertainty. So I think for managers to also recognize that this decision fatigue is real for all of us. And so while you're giving choice and flexibility, also help your folks know, like, here's how I'd prioritize things. So of this list of 10 things I gave you, focus on these 3 first. That's one less thing I have to triage myself. And I think that can really help people with their productivity and managing their time in the chunks that they can be productive.
Oh, I was just going to add, this flexibility issue, I think, is so key. Like, I'm so glad you highlighted that, because it is such a big thing. And I think moving forward, like, there's going to be a lot of places that are restructuring, they're rethinking their workplaces after this pandemic. I mean, we're already seeing it, that, universities are talking about, like, more remote work, and, maybe we don't need everyone to have their own individual office, and we're going to do, like, a office sharing system. But I think really thinking about the potential extra burdens that those things are going to put on parents, if you don't have an office to go to. So, there might be some benefits for some parents for working at home, but for others, it's not a good situation. And, like, getting out of the house, getting to the office is where they can really be productive and not have those interruptions and not have those issues. And so just, yeah, choice and flexibility is key there too, as we envision, like, we've been doing this in an emergency situation because we have to, but whether this is really the best way going forward. And I think a lot of places want to save money by, well, let's just cut down the physical infrastructure. But that could have a disproportionate impact on working parents, I think.
That's right.
So just something to think about.
Yeah. And the takeaway there for me is, like, don't make assumptions, ask, right? Don't assume because you're thinking, oh, this will be better for parents. If you're hearing yourself make those assumptions, this will be, but ask, because it may be very different circumstances for different members of your staff.
Yeah, such a great point. And it makes me think about, what I'm noticing is there's this, like, have and have nots conversation happening around work from home. And it's so interesting because it's not the same for any one person. You may be someone who's working in a plant or in a lab or something, and you're looking at people who are working from home and saying, oh my gosh, they have it so good. But then the parents are like, no, I just want to come in and be able to focus on my work. And so it just paints the picture of truly understanding your workforce, asking, Amanda, to your point, asking the question and creating spaces and scenarios that do present flexibility and choice. I keep saying choice because I think the organizations and the workplaces who are saying everybody works from home, they don't have it right. And then you have the people who are saying everyone come back to work. They also don't have it right because they're not providing choice. They think they're providing flexibility, but they're really not.
Right. That's right. Yeah. And I think a lot of parents, if you ask them, I'd love to be back in the office, but we don't have that option, or I don't have childcare. My kids are still at home. So even if I would like to be, I can't. And so I think absolutely. Yeah. Just meeting people where they are, or at least trying to understand where they are rather than assuming this is going to work for everyone.
And understanding how you might end up, inadvertently pushing a huge segment of your workforce out if you make these decisions, especially without them involved in those decisions.
So that's a really good segue into another question here, which is working women and working moms in particular. I know we're talking about parents and the research around the impact of parents, but with some of the research I've done in the on the organizational psychology perspective, we're finding unemployment rates. Women are opting out of the workforce, basically. And obviously, I think one of the main reasons is because of the parenting situation, and also the disparities between parenting responsibilities and also just out of pure need. It's either, I either pay my light bill, take care of my kids, or go to work. I mean, it's a horrible, horrible situation to be in. So wanted to hear from both of you, maybe starting with you, Lindsay, on the impact to working moms specifically.
Yeah, no, it's a great, well, it's not a great issue to be considering, but it's an important issue to be considering. And I just read a headline the other day too, that was about the impact on Black women in particular. So we have to think too, that not only is this pandemic disproportionately affecting women like in the workplace, but it seems like it's, affecting like based on race, based on income and all sorts of other factors. So we really need to consider the intersection there. And I just know that I see one scary headline after another about, women being kind of set back generations by this. And I never would have guessed, I don't think I even fully knew what a pandemic was a year ago. Like if you had asked me to define that word, and to think that it could end up undoing so much progress, in part because we have these gendered ideas about the workplace and about parenting responsibilities. And so, I'm very lucky that in my marriage, that's not how it works. And I arguably get more time to work, and, my husband takes care of more of the parenting responsibilities. But I feel for women who are not in that situation, who have to make those difficult choices, which I think are sort of more like a Hobson's choice, right? It's not really like they're opting out of the workforce, like they're being pushed out of the workforce because we don't have policies in place that, and we have this webinar coming up where we're going to talk about women being pushed out. And one of our guests, Dr. Jessica Calargo, has this amazing quote, which was, and I hope I get it right, but I'm going off of memory here. But other countries have social safety nets, and the US has women. And that just hit me so hard. So many of the things fall back on women to kind of hold up. And I mean, so the situation is probably a little bit better in Canada where I am, which has a bit more of a social safety net, but still not perfect. I mean, it's still, by any means, there's women dropping out of the workforce here too. So that's just, yeah, that, the US has women, and that's just.
Yeah. I think I struggle too. I'm glad you brought that up. Like even when Angela said, opting out, which is how it's being talked about, right? That women are opting out of the workforce. And for me, I just think that's the wrong word. Like women have been faced with an impossible choice. It's not a choice. And I have, even with all my privilege and all the resources and the flexibility of my job, there have been moments throughout this pandemic where I have been in tears and said, I can't do this anymore. I can't do all of the things. I can't be here in the way my kids need me to because they're falling apart and do my job, even in a mediocre, bare minimum way. I am dropping balls left and right. I can't do this anymore. And and then I've been able to get through that because of all of the layers of privilege I'm so grateful to have. And that's why I think for so many women, it is not a choice. I am not opting out. I literally can't. Either somebody's here to watch my kids, or I can do my job, or my job is such that I'm not able to do both. I have to leave the house, and that's not possible because my kids aren't in school right now. And so I think it isn't a choice in the way that it's often framed in the media. And part of the reason I think that happened at 6 months is because when it first started, right, as you both mentioned, right, it was this emergency situation. It was like, okay, we're going to get the kids through the end of the school year, and then we'll be in the summer and it'll be fine. And I can hang in there, and my job will let me hang in there for this period of time. But then we hit that 6-month point. The fall, semester started, kids were supposed to be back in school, and this wasn't changing. And that's when I think a lot of women were faced with that conundrum of, we're staring down the barrel of another year of this, and there's no way. I could hang in there for a few months before, but this just isn't going to work. And so, and to see the rates and headlines like Lindsay mentioned of women being forced to leave the workforce because of various responsibilities, it really is concerning.
And I appreciate you mentioning that, Amanda, about the opting out, because it just naturally slipped out of my
right. That's how we talk about it.
That's how we've been talking about it. And I love the fact that you've challenged that, because it's completely, you're absolutely correct. It's, you're not having a choice to say, I've got these two choices, I'm choosing this one. It's pure survival mode at that point. It's like the survival mode of yourself and your children, and your family, and the livelihood. There is no choice. So there is no opt-out. It is just,
right.
it's a dire situation.
And I think,
which I just think comes down to childcare. That's all. Like, that's why it's not a choice, right? Because if my kids can't go to school, there is no childcare. So I can't do my job, and I have to be the childcare. Like, I think that's what, like Lindsay was talking about with the social safety net too, which is blowing, putting such a huge spotlight on this as an issue, not only in America, but in many other countries, the need to focus on childcare policy. But sorry, Lindsay, go ahead.
No. And I remember bringing up, I'm quite privileged in many ways. I have tenure, so I try to bring up these issues a lot in meetings and to just keep them at the forefront of people's minds. But I remember very early on in the pandemic in a meeting saying, well, I'm going to have to see kind of how this goes, because if this continues on, like, I'm not going to be in a position as a parent of young kids to, I forget whatever the thing was, but I said, I'm not asking for like special treatment because I have kids, because, a lot of people say, well, being a parent is a choice. And yeah, that's true. But one of my colleagues said, childcare isn't like a privilege, it's a human right. And so, a lot of people who I see different comments about how people don't want to take care of their kids, or people chose to be parents, so now they have to deal with it. It's like, well, we chose to be parents when, schools existed and daycares existed and grandparents and other family members were around, or if they weren't, like, or you could hire a babysitter, or you could, there's just very different circumstances when a lot of people like decided to become parents. And so so that's something that I think about a lot. But childcare policy is absolutely something that and again, like, if you look at, well, who's making the decisions about these things, who's in charge of childcare policy? Are they people who have young kids themselves, or who did at one point and they've forgotten? Like, there's we need like women at the table really helping to make these decisions.
Yeah. And even like I was just thinking as you were saying that too, the medical leave pieces of this, if I sort of think about from the employer's perspective, like, I have many friends and family members in the healthcare sector, and they were terrified of getting COVID, not because of their health, which is of course what we should be worried about, or their family's health, but because then I'm going to be forced to be out of work for 2 weeks or longer. And what's that going to mean? And I don't have any more sick leave. And it was like, and you're the essential worker taking care of us, and this is the stressor you're feeling. And so I just think the childcare policy, but just also, as Lindsay mentioned, many parents aren't just caring for their kids, they're caregivers for, their own parents or other family members. And so, of course, our medical leave policies need some work, as we're faced literally in a situation where, as somebody who got through COVID myself, I was laid out for almost a month, and thank God my job was flexible, and we were still trying to parent kids and still trying to manage, but, not factoring in, as employers either, like, what actually happens when you get COVID. And now I'm trying to still do my job, still parent my kids through everything they're going through, and I feel awful.
Yeah.
And if you were paid, if you were working in a job where you were paid by the hour, like you can
Right.
see why people. So one of my colleagues at Brock University, Angela Evans, did a really cool study towards the beginning of the pandemic, looking at she studies lie telling, and she was looking at people's deceptive behaviors around COVID-19 and finding that like a shocking number of people were lying about their symptoms, lying about their COVID status. But they're doing it because they need to survive, or like they need their paycheck, and so these are people again in an impossible situation. But there was a lot of that, about lying about their travel, lying about like their exposures, because they didn't want to be told, well, you have to now quarantine for 14 days and you're not going to have any money for that time. Like most people cannot miss a paycheck, even one, right? Like most people live paycheck to paycheck. So it's really, I know that maybe government wide, like, it's harder to change these policies, but individual companies can hopefully have more flexible policies and probably find that, well, I mean, you're the IO psychologist, right? So but probably find that their workers are happier, and that, they're more loyal and all of those kinds of things if those policies do exist.
Yeah, I mean, it's the gap is narrowing here for companies, I think, to step up to the plate around their responsibility around their employees' lives outside of the workplace. It's like, again, you are, I'm my philosophy around this work is, employers have a responsibility to send happier humans home so that they can be better to their kids, to society, to communities, right? You have these people, 8 hours a day or more, and you're either creating really happy, fulfilled, purposeful humans, or you're creating stressed, sick human beings who are then taking that out into their societies and to their children, to their families. And so there is such a grave responsibility here for employers to have to support. And so what I'm hearing is, I think employers, absolutely, flexibility is really, really important, and not putting parents in a position where they have to choose between safety, health, and work. I mean, that's just, and that seems like a basic human right even. But employers, I think, can do a much better job at providing that support and really understanding what kind of choices people are having to make day to day if they're exposed to COVID and they're lying about, just so they can come in and get a paycheck. Let's clear that barrier for them. Let's not have them lie and put other people at risk. Let's give people time off, so if they are exposed, they can take time.
And
So
when you give
like
them, give them some of that breathing room. Like, I just think, we were talking just a minute ago about moms specifically, like there's nobody better at this than moms, that when you tell them, like, here's what's in front of you, here's what you have to figure out, these are the tasks to get done, you figure out the best way to do that. Like, that's what we do all day long with figuring out, okay, this kid needs his Valentine's, this one has, crazy hat day at school, and this one, and meanwhile, I'm firing off this email to somebody at work. Like, this is what we do. I mean, one of my favorite quotes I saw on a sign was, a worried mom does better research than the FBI. And it's like, if you give moms the latitude, they will be your best employees if you just back off and let them figure out the way that works for them within their system. Because right now we have no work-life separation. So I love what you were saying, Angela, about like sending your employees home happier. Like, I'm in it. I'm in all of it all the time, all day long. And so let me figure out the way that makes the most sense. And I will get it done for you. And I will get it done well if you give me the latitude to do that in my way.
And this is sort of random, but thinking about how that lack of work-life separation has been really challenging in many ways, but also has been quite interesting to watch my kids, like, who never knew what I did before, right? Like, now mommy has a meeting or I'm working on something, I get to talk to them more about my work, and they know that I'm upstairs working, and it's sort of this weird. So yesterday my daughter was reading a story, but she just kind of like tells the story as she's going, and she kept repeating, well, and mommy has to work all day long, and I was dying inside. I felt so guilty that she was reading this story where the mommy had to work all day long, even though at the time she had a snow day and I was with her. So, clearly I wasn't. But then I said, well, why does the mommy in the story have to work all day long? And she said, because she loves her work. And I thought, like,
Oh,
wow, like that's not what I expected her to say. I thought she'd say because she has to make money or whatever, but just the fact that she now thinks that I love what I do, and I do, right? Even though it's challenging, of course, but I just thought that was so, that's something that wouldn't have happened without this situation. I mean, I'm not saying that's worth this whole year of a pandemic or anything, but it just made, when you said the thing about, you can have your workers be happy and like take that elsewhere. And that's just a prime example, I think, of how I've seen that
yes.
come
I
through.
I love that example. That's awesome.
Yeah.
Yeah, I think about how much more my kids too have had exposure, like even with our pandemic parenting stuff, right? I'll hear my tween sort of like, "Ugh, do you have another webinar tonight,
Yeah.
mom?" And it's like, but then he'll say, "Oh, this is the one for parents," right? And it's like, even in his angst and eye rolling, like what he knows is what I'm trying to do is help other parents. And so the lessons and things that he's learning in that, or times that they've gotten to bust into my class, and say hi to my students and have my students get to know them, like that wouldn't happen if I was going to campus. And
Mhm.
so yeah, I
And I think
agree,
about what
there are
we're
really going to be
showing,
some lessons.
yeah, what we're
Mhm.
showing to students too, right? Like my kids would interrupt when I was teaching my grad students or teaching my undergraduate students, and it's like hopefully we're modeling for them, you know, because I think in many, areas of work that a lot of women are always concerned about, like, well, how would I have a child and how would this factor in? Like you do hear that a lot more from women than from men, but it's like, well, now you're seeing an example of somebody doing it and, not apologizing for it. So it's
Right.
just, yeah. So I think that's a positive thing too.
Yeah, all these
Mhm.
all these little silver linings I think are really I'm sure it's a part of a lot of your like resilience research around this and the resilience of parents, which is there are silver linings. There's a lot of crappy linings to this whole situation, but there are some silver linings. And I think one of them is also how employers are going to think about um, parents in the workplace. And again, the word grace comes to mind in that, it's now acceptable, if your kid jumps into a meeting, even if it's a super formal executive meeting, everyone just kind of smiles and goes with it. And I'm seeing that change in behavior within the workplace. And I think that's a great silver lining.
Mhm.
Yeah.
So
Yeah.
yeah, I think there's some good things that have come of this too, even if they're small. And I wanted to, 'cause I can talk about this all day, and I want to make sure that you all are able to tell our listeners about your upcoming webinar, because that is just one of many resources that you all provide. So maybe Amanda, can you tell us a little bit more about the upcoming webinar on February 25th, correct?
That's right. So sure, Thursday, February 25th at 9 p.m. Eastern. So we intentionally do these webinars late in the evening in the hopes that, we're not interfering with bedtime and dinner time chaos in homes, because we get it. We're there, right there with you. So it's called Push to the Limit: How the Pandemic is Impacting Working Moms. And we'll be featuring Dr. Jessica Calarco, which we mentioned earlier, and Dr. Amy Knopf, who've been doing some really fascinating research specifically on working moms and various aspects of the pandemic and how it's impacting this on many levels. You can register at www.pandemic-parent.org. And it's free. And even if you can't join, you're welcome to register. We'll send you the recording afterward. We always post all of these resources on our website and our various social media channels. So we encourage you to join us. It'll be a really interesting conversation, I think, with some very helpful tips that will come out of it along the lines of what we've been talking about here today. So please join us.
Awesome. Lindsay, anything else from you before we kind of close out and say goodbye?
Oh, I think I gave my best bit with my story from yesterday and the the 3-year-old home for the snow day. No, I really hope that that we can have, ensure that parents' voices are heard throughout this process, and as we're thinking about the right now, but also as we're envisioning, the post-pandemic workplace, that we consider all of these different angles and all of these other responsibilities that have been pushed to the forefront during this time. So yeah, thank you very much for having us.
Yeah, thank you. I just want to thank you both for sharing your personal experiences. One of the things that, one of the reasons why I reached out to both of you is because I am not a parent. And I'm in this position where I'm talking to executives and leaders, and I see the research, I hear the research, but this was such an important learning process for me too, because now I'm more informed about how I can better help these organizations with shaping this experience for parents moving forward. So I just want to thank you both for sharing your personal experiences, but also all of the fantastic work you're doing around pandemic parenting. Thank you so much.
Thank you for having us.
Yeah.